Hundreds of thousands of dollars are coming to Spokane County law enforcement. The money will pay for new officers and deputies who will be dedicated to mental health calls.
We've always come across people that are in crisis because of mental health. We seem to, as the years have progressed, encounter that more and more often.
The $700,000 grant will allow both the Spokane Police Department as well as the Sheriff's Office to add 2 co-deploy mental health teams each, along with a supervisor that may go to the county or the city.
With the mental health.
Not only does this allow officers to really pinpoint why someone may be in crisis,
it's also a way to avoid taking someone to jail or the hospital when mental health help is what they really need. 4 News Now reporter Katerina Christophes joins us live now with an in-depth look at what these new positions entail. Katerina?
Officers began pairing up with mental health professionals almost 2 years ago, but thanks to a $700,000 grant, they'll have even more help than usual.
I feel like I'm actually helping people.
Dave Duncan has worked as a police officer for 15 years.
Channel 2, the service, if you could switch over.
Recently, the amount of mental health calls he's responded to has grown significantly.
It is not uncommon for me to have an entire day where that's the only kind of call I handle.
And the way he's able to respond to those calls has also changed.
If you can calm them down with just words, I mean, that's a win every time.
But it didn't happen overnight. It all started 2 years ago when the Spokane Police Department first started pairing officers with mental health experts.
The mental health professional can then go and really spend their time with that person, getting them the resources they need or figuring out what the best solution is.
Now, thanks to a $700,000 grant, they'll have even more help. The grant will fund 2 county deputies, 2 city officers, and a supervisor, all who will permanently be partnered with a mental health specialist from Frontier Behavioral Health.
We may not know until after we've got everybody kind of contained and handcuffed that there's somebody with with some kind of a mental health issue.
So now, out in the field, we have access to that person's history, what problems have been in the past, what's worked, what's not worked, what could maybe be a catalyst that as a street officer I would have no idea because they're not articulating it.
It's a way of taking something good.
We've had good success with the program we have.
And making it even better.
You have the ability to affect a change.
So officers can continue to help those people.
It just became obvious that this was our job, this is what we do.
Who may need it the most.
No matter what you do.
Now, both agencies hope to have those positions up and running as soon as possible. Live in downtown Spokane, Katerina Christophes, 4 News Now.